Okay, thanks. So just wanted to kind of give you some background to the incubators, because I think the incubators were an interesting concept that I've inherited from the crazy Dave Jones, and I'll talk about that. And they kind of represent quite an innovative part of, I think, what the Academy is trying to do. But just to put it in context, hopefully you've all seen this is around the different pillars that we have across the NIHR that underpin the improving the health and wealth of the nation through research. And a fundamental part of this, which is where the Academy comes in, is around attracting, supporting and retaining the best researchers. And to kind of put the incubators in context, I just wanted to give you a little bit of background. So the incubators were a direct result of the NIHR Strategic Review of Training, which we did in 2017. And we had decided that after 10 years of the NIHR existence that we had enough evidence and enough experience to have a look at what are the things that were working and what are the things that weren't. And one of the things that we came up with, there were a number of things that the Review of Training initiated, including the establishment of the NIHR Academy was one, was this idea around incubators, this kind of as a kind of almost perfectly formed environment to tackle some strategic areas where we knew there were research capacity issues. And so it was around bringing together people that weren't necessarily working together to support capacity building in particular areas of strategic need. So the incubators are basically, they're very different in their concept, and I'll go through the incubators that we have, but they have to be, because they need to address the needs of a specific area and community. They need to provide targeted career development and support, and that's kind of why they exist. They have existed around a particular need where there's a barrier, and some kind of short-term work where we can try and unblock that barrier. They are absolutely around encouraging early career interest, particularly in target disciplines and disciplines that we may not have appropriate representation, but also to build cohorts and identifiable communities. And I think this is one of the things that the Wessex initiative is incredibly strong in. And the funding is time limited, so there's not a lot of funding involved with them, but we're hoping that they're a short kickstart to try and do something different. So the incubators, we established a number of incubators that were in areas of strategic need that came out as a direct result of the review of training. And these include emergency care, health data science, nursing and midwifery, primary care, public health and social care. And these are areas where we already, particularly in nursing and midwifery, primary care, public health and social care, we have some initiatives already in existence, but we needed to bring areas together. We then opened it up to an open competition, and we received a number of applications, but the ones that presented the most compelling case were around methodology, clinical education, advanced surgical technology and mental health. And so these are the incubators that we have. Now, you'll notice that Wessex is not on that list, and it's not on the list because we don't actually think of it as an incubator. We think of it as an initiative because it's the first, and not just because it's the first geographical incubator, because it wasn't built around a need and a problem. It was actually built around as an exemplar of how to bring things together. And we know how well Wessex actually, do academic capacity development. But the application for the incubator was really more around making this even more joined up and profiling it. So we don't like to call the initiative necessarily an incubator because it kind of seems like there's a problem. But we're seeing this very much as an exemplar. And this is kind of what I think of in terms of what the Wessex initiative is. It's really like the good old farmers model 4200 Pro Series circulated air incubator with automatic egg timer. So this is how we do it and how we do it properly. It's around absolute innovation. Just to kind of quickly go over some of the initiatives that the other incubators have. So we have, this is, if you would really like to see a good exemplar of a website that's around career development, I'd strongly suggest that you look at the Incubator for Mental Health. So it has a number of different things around starting a research career, finding out about research funding, and importantly, profiling a very diverse group of clinical academics from different disciplines, from different backgrounds, to say this is what I've did. And then if you look at the Advanced Surgical Technology Incubator, that has a much more targeted approach around across health professional capacity development. And so I'm hoping to kind of show to you that, you know, not one size fits all, and we have very different approaches. But just wanted to absolutely highlight that we don't see the Wessex REACH initiative in terms of trying to solve a problem. We actually see the Wessex REACH initiative as something where we have a lot of excitement around the innovation that is being demonstrated here. So just on behalf of the Academy, I just wanted to absolutely wish you every best wish for today, for the launch, and for the initiatives going forward, and we're looking forward to watching you grow and develop.